So, doctor, what are the professions through which that they have prone to a hearing loss, or they have high exposure to get a hearing loss?
So I'll try to put this into two categories of patients. One is those who are exposed to loud sound. This can be short duration loud sound or prolonged duration loud sound, and those who are exposed to, you can say, near comfort level of hearing, but for a very prolonged durations. So in the first category, where patients are exposed to loud sound, for example, those who are working in construction industries, drill works, those who are in aviation industries, those who are in mining industries. These patients are exposed to loud sound. Gunshot injuries is an example. Also in our armed forces, where they need to use good protection to protect them from hearing loss. What I want to mention in this category is that these kind of hearing loss, which happen due to certain exposure to loud sound, are generally permanent, and therefore immediate intervention or medical treatment may be required as soon as possible. The second category belongs to those patients who are exposed to near normal threshold of hearing, but for a prolonged duration of time. This is a new entity, and this is what we have been encountering in patients who belong to IT sector or back office people who use headphones, and they have to use these headphones for meetings and taking up calls and variety of other reasons for a prolonged period of time. These patients may not develop a sudden hearing loss, but the initial manifestations of like discomfort on prolonged exposure to sound, pain in the ear, and gradual hearing loss is what we see. In this case also, immediate seeking of medical, as soon as you notice the problem, you should see a ENT doctor, get a hearing test done, and then the treatment can follow after that.
So doctor, what are the main causes of hearing loss in elderly patients?
All right, Ashwini, so earlier you asked me about the causes of hearing loss in children. So now we're going to talk about hearing loss in elderly patients. All right, so in elderly patients, I'll try to put the causes of hearing loss into three categories. The first one would be the natural cause of the hearing loss, which, like all body functions, tend to decline as you age. Hearing sensitivity also tends to decline with age. We call it presbycusis. The second category of patients will be those who have diabetes and other comorbidities requiring ICU stays and all those things. So these patients also tend to have hearing loss, and these hearing loss are generally associated with the event. For example, a certain spike in blood glucose levels, which has been poorly controlled, or you're not taking your medications very well. In these patients also there tends to be a hearing loss. Of course, in this category the hearing loss tends to be more abrupt than compared to those patients who have a natural progressive hearing loss due to age. Then finally, the third category of patients will be those patients who are exposed to certain medications. These elderly populations are more prone to hearing loss due to medications compared to the younger population of patients. In all these cases, we need to do a hearing test, and based on the amount of hearing loss, we have to take a call as to what should be the best mode of treatment, whether it's going to be hearing aid or anything else.